Welcome to the Bionic Pets video series of How to Do What We Do. This step-by-step series shows loving pet owners worldwide who can't come to us how to cast and fit orthotic and prosthetics for their pets. Bionic Pets offers a wide variety of colors for your custom device. Please indicate your color choice on the order form. The materials included in your casting kit are as follows: an order form, casting instructions, fiberglass casting tape, a cut strip, a pair of gloves, a stockinette, a clever cutter, and a pair of scissors. Hi, I'm Derek Campana with Bionic Pets, and today we're fitting Shadow with a custom carpal device. A lot of times we get an injury called a carpal hyperextension. You'll see the dog's carpus or wrist collapse all the way down. This injury happens a lot when a dog or animal jumps from a high elevation and they tear the ligaments on the back side of their wrist. I'll do a pre-fitting and check and see if how we're looking with this. I'm making sure that the paw fits nicely down into the bottom of the paw section. A lot of times I can build this with or without the paw section. Adding the paw section gives a longer lever arm and therefore better pressure distribution and prevention of abrasion and irritation. We can also always take this section off later if the dog can't adjust to a brace with a paw section on it. In the box, if the dog's leg is the right size, you'll get a 3-ply soft sock. You're going to want to put this on first. It's not mandatory, but you at least want to use it during the break-in process. We're going to make sure we get all the wrinkles out of this. We want to apply the sock nice and tight. Make sure none of the dew claws or claws are catching in it. You don't want this loose and wrinkling inside the device because that can cause irritation as well. So a lot of times, what I do to get this on is I slide the paw back into the device. If you try to just place it in, a lot of times it'll go too high like this. So sliding the paw back like so will make sure that the paw is in the correct section. From there, I'll make sure I hold the leg in that corrected position and hold the entire time while I'm strapping it. To lock in the leg to the carpal brace, I'll usually strap the bottom strap first. Because of this angle, it'll lock the paw in there. You want to make sure that this pad is centered over as much of the skin as possible. And again, I'm constantly holding the paw in the device. You're going to go through your D-ring, make sure the strap goes directly back onto itself, and then I'm going to slowly move up. Your device can have as little as 2 and as many as 4 straps, depending on the size of your dog. Again, I'm making sure that this pad is centered over the front of the leg, not torquing or twisting the leg as I'm pulling the straps tight. You want these to be rather snug. If the straps are too loose, your pet's going to pull out of the device, or the leg can piston up and down inside the device and cause skin irritation. Then I'm going to move myself up to the 3rd strap. From there, once we feel like we have a good fit, it's important to mark the straps for tightness. So you want to mark them just at the D-ring so you know how far to pull until you see the mark. You can also mark these in sequence, 1, 2, 3. So if anyone else is fitting the device, they know how tight to make the device and the sequence of the straps. We also make a tether system. This is adjustable. Most likely, the best thing to do is, depending on the injury, is to lock this out or give it just 5 to 10 degrees of range of motion. There's a lot more range of motion in this because we have it on the 2nd hole. So I would suggest putting the screw in the uppermost hole and then over time increasing range of motion gradually. You can always talk to your vet or healthcare provider or call Bionic Pets to see when and how much range of motion is needed per injury and per pet. From here, I'm going to fold the sock over the top of the brace. This will prevent the sock from sliding down and bunching up inside the device. If you have a dog that likes to bite at the straps, you can also pull this sock all the way down over the straps. And if you need it to maintain there, you can put a rubber band around this and it'll hold that in place. So basically, we have an injury, and this can be used as a transitional device. We can take the paw section off later, we can increase range of motion over time, and we can completely remove this tether over time, depending on how good your dog's wrist is healing. And that's how we fit a custom Carpal device. Your Bionic Pets custom Carpal brace will have a non-porous foam liner. This will not absorb any moisture, sweat, urine, and is waterproof. You can actually use this in an underwater treadmill. This foam can compress over time, and I would suggest taking a hairdryer to it once a week to fluff the foam back up. If it doesn't fluff up anymore, we can send you some padding to put in there or retrofit a liner if needed. Once a day, you should also take a baby wipe or an antibacterial wipe and wipe the foam down. And that's kind of your wear and care for your foam. Check for any skin irritation or redness. Most commonly, you can see irritation between the toes or on the sides of the paw. You can see it in the back of the carpus as well, or the uppermost edge of the brace. You want to make sure that this is not too high. The elbow is clear. We don't want to cross into the elbow. I know it's hard to see on a black dog with a lot of fur, but the elbow is right here. Want to make sure we have at least one finger below the elbow of clearance. Want to make sure she can bend her elbow as she's going through the range of motion of her gait. If you do see any pink spots or a little bit of skin irritation, if it goes away within 20 minutes, that's okay. If it's dark red or lasts longer than 20 minutes, please contact Bionic Pets and we can heat flare, pad, remove sections of the brace as needed. Dogs also run, jump with these devices. These screws can loosen, so you want to make sure at least once a week you check the tightness of these screws because they can pop out. If they do, you can call us and we can send you new ones, but it's better just to make sure that these are tight all the way through. And that's your wear and care for a custom Carpal device.